First of all, I would say that though we have been shuttered for the last year, as most of you know, we actually have not been doing nothing. We have been really busy at work, not only planning for our restart season and for all of the things that surround that, but also we've had some good news along the way. And I want to share a little bit of that with you. Some of you may know some of these things, but we were fortunate earlier this month that yet another of our recordings has received Grammy recognition for our recording of Christopher Rousse's Fifth Symphony. And you'll hear more about that and the role the orchestra played, the musicians played in that, and some of their views about that. We also last month received an Emmy Award, a regional Emmy Award from the regional Emmys for a production entitled We Are Nashville. And that was created by our own Bryson Finney on our education team, together with Titus Underwood and a number of other folks. And so we're very proud of that Emmy Award as well. We've had some success in the fundraising arena, including recently the Andrew W. Mellon Foundation approved a second round of funding for the next 4 years, a $900,000 grant to continue to fund our Accelerando Music Education Initiative. And we were fortunate to receive a second round PPP loan recently. So that, along with a robust annual fund this year, for which we owe all of you a great deal of thanks, because so many of you contributed to make that possible. As we plan our upcoming season, you know, we believe now that the vaccines are beginning to be distributed at an increasing rate, in an increasing pace, that the light we see in the tunnel is not a train, but in fact the end of the tunnel. We know that we're not out of the woods yet with regard to the pandemic, but we also know that the future is beginning to look brighter and brighter, and I think we're all feeling that optimism. The board of directors of the symphony back in the fall established a committee known as the Restart Advisory Subcommittee, and those members of the board that are on that committee have been working tirelessly with the administrative staff and the management to develop a plan to reopen safely and to reopen when it became possible. And we have for you an interesting plan for what is, believe it or not, our 75th anniversary season coming up in 21-22. And so we're really looking forward to that, celebrating not only our 75th birthday as an institution in Nashville, but also celebrating our return to the stage. We have developed a ramp-up kind of reopening plan, a plan that involves scalable concerts. So when we start out, we will start out doing what we know we can do at this point. We'll likely have social distancing within the audience and on stage. I can assure all of you that though we may all have to put up with some temporary inconveniences, that you'll enjoy a full season of robust programming, and in some ways, some of the most innovative and creative programming that we've put on the stage in a while, simply because we've had to adapt to the conditions and pay attention to the changing conditions. It'll start out a little differently than we have in the past. You know, we very often like to play big, bold works at the start of our season. You'll probably see that modified a little bit differently so that we have kind of a ramp up path. And you'll hear more about that later in the call from our musicians. We'll work our way toward full capacity as the year moves forward. And we're looking forward. I can't even begin to tell you how much we are looking forward to welcoming all of you back into the concert hall and to welcome the orchestra back onto the stage. It really is something that I think is going to be a joyous celebration and really cathartic for all of us. So You'll hear more about that as we move through the evening. Safety planning for that season, of course, is a top priority. And I want to say a very special thank you to HCA Healthcare and TriStar Health, who are with us on the call today. I know that we have Dr. Kenneth Sands and Edmund Jackson are both on this call, along with a couple of members of our staff. But we've been working hard on our health and safety plans, not only with our musicians and staff, but also thinking squarely about our audiences. So you'll hear about that this evening. And I can tell you all that we are also at this moment currently planning to do some concert activity in the spring and summer. And as valued patrons of the Nashville Symphony, you all will be among the first to know about that and among the first invited to take part in those concerts. And we're collaborating with the orchestra and our musicians in this very first step in our reemergence.
Hello, everyone. My name is Jonathan Norris. I'm the Vice President of Development for your Nashville Symphony. And it's my pleasure to introduce this next segment. HCA Healthcare is a longtime partner of the Nashville Symphony. And over the years, they have helped us to bring in some of the most memorable performances at the Schermerhorn Symphony Center as part of their Legends of Music series. When we had to cancel our season this past year due to the pandemic, HCA began discussions with us about how they could help. The result of those conversations has turned into a new partnership that has exceeded our wildest expectations. HCA has always been generous, but now they have made available to the Symphony a network of resources that is immeasurable. Access to experts, project management specialists, equipment, and testing. Now it's my great pleasure to turn this over to our Vice President of Operations, Sonja Thoms, who has not only been running point for us internally with our health and safety restart planning, she is going to lead the conversation with one of our incredible members of our health and safety restart team, Dr. Sands from HCA Healthcare. Sonja?
Thanks, Jonathan. Good evening, everyone. Thank you so much for being here this evening. We'll dive right in because this is a big topic. And Dr. Sands, thank you so much for being here this evening. It has been quite a road the last year. And so I guess just diving in as Chief Epidemiologist, what has your year been like at HCA Healthcare?
Yes, it's been quite a year. There's no question about that. I'll just give you a little bit of my background. I've been with HCA for coming up on 5 years. My background is as a physician in infectious disease and hospital epidemiology. Prior to coming to HCA Healthcare, I was in Boston at Harvard Medical School and working at one of the teaching hospitals there, Beth Israel Deaconess Medical Center. Nothing could quite match the excitement of the past year and working at an organization the scale of HCA Healthcare. We have 187 hospitals in 22 states and many other sites of care beyond that. And we've taken care of more than 150,000 COVID patients at this point in our hospitals, something approaching 8% of all the hospitalized COVID patients in the United States. And it's been a really steep learning curve from beginning where we were just learning how to count and identify how many patients were in our hospitals to identifying treatment strategies, to being able to actually measure with Dr. Jackson's help. I see Edmund is joining now, that more sophisticated ways of measuring the care that we were giving, and at the same time measuring the safety that we were providing our own clinical staff. So we're quite proud of the outcomes we've been able to achieve. Some other exciting things that have happened along the way, we're supporting the Belmont presidential debate and managing the safety protocols for that event, which served to provide a lot of learning for what we're now doing for the symphony. And then the effort to vaccinate our own healthcare workers and supporting community vaccination as well. We've probably given north of 500,000 vaccines at this point amongst both our hospital staff and supporting different community organizations in the different states that we're in. So it's been a really amazing journey. Lots to be proud of, and nice to see that we are starting to reawaken activities like the symphony, and very happy to be a part of that.
Absolutely. Well, Dr. Jackson, thanks for being here tonight. Could you talk a little bit about what your role is at the HCA Healthcare and what these last many months have been like for you?
Thank you, Sonja. Yeah, my role at HCA Healthcare is to support the clinicians with data and analytics. And so during the course of the pandemic, that's been sort of on the long range to try to get ahead of the pandemic, to understand where is it going to emerge, how seriously will it emerge there, and are there any patterns or predictions that we can come up with? Will it be in certain communities, subsets of communities, and how can we prepare ourselves for that? On the more acute side, it's been really trying to create tools that are based on data analytics, predictive analytics, to put into the hands of our caregivers and our administrators so they can handle the day-to-day volume of COVID that we experienced. I mean, to be clear, our hospitals were at and beyond capacity in some areas for extended periods of time, and managing that degree of stress and pressure operationally as well as psychologically was a huge undertaking for our organization. And so, with colleagues like Dr. Sands, we really tried to provide that bedrock, that foundation of support to enable us to meet the challenge of what COVID-19 sent our way.
Incredible. So with everything that's been going on, of course, then our paths have crossed in the last few months. And as Jonathan and I and the rest of our team have gotten to know your team, your project management team, it's been really tremendous to see the resources that you've been able to share with us. And so I wonder, Dr. Sands, if you can talk a little bit about now approaching the conversation with us, the Nashville Symphony, the Schermerhorn Symphony Center, and also our partners across town at TPAC. What have you been learning in the process of addressing our unique situation?
Well, it's every one of these situations is different, and so it's been great fun to learn about symphony operations and to see the Schermerhorn and see the capabilities there. I think you are well positioned to be safe and to be able to offer service to the public in the form of events. The things that we bring to the evaluation includes looking at the building itself, its size and shape, and then some of the engineering involved. And I think those have both been really interesting for us to look at and favorable. And I say that because it's such a large space. If you're worried about respiratory spread, a big factor is how much volume can that spread in, and having a very, very large volume is favorable. It's also very favorable ventilation. The way the air moves in that concert hall is directionally up. Circulation is, the turnover of room air is very high. The filtration is very good. And we checked all those parameters, and we feel very good about that. The main concert hall has a lot of flexibility with your ability to extend the stage and move seats. So there's lots of things there that give you the opportunity to create a safe environment. So there's those environmental factors. There's the opportunity to social distance, the 6 feet apart, which is sort of a keystone of being safe. And then, we've walked through for those situations where it's not going to be possible to maintain social distancing because of just some of the constraints of the space or the constraints of playing music together. That there's other options that we have for protection in terms of testing, in terms of the room setup, all of which we've gone through, and we're feeling very good about the strategies that we have in place.
Yes, your team has been great in giving us feedback and really in-depth conversations about all the particulars, the backstage space, the onstage, the front of house, the seating. And so, Dr. Jackson, I just wanted to turn to you as we kind of close this segment soon. you were talking about predictive and analytics, and we're all eager to open next season and even get the musicians back on stage sooner this spring. What are you looking forward to the next 3 months or so? Like, what are you thinking about? What are you going to be watching for?
It's a complex thing, Sonja. For us, it's the uptake of the vaccine is the most important element here, because that is, the HCA wording around this is how the pandemic ends, and it really is how the pandemic ends. And so our encouragement to everybody is, please, go get the vaccine. If you haven't yet, get it. Encourage people to get the vaccine, because that's how we put a lid on the spread of COVID-19. On the other side of the coin, we're carefully watching the variants as they emerge and spread. And this is an important factor that, the longer we allow COVID-19 to spread in our population, the more chance it has to mutate into a new variant that can cause us harm. So honestly, it's all about vaccines. It's all about public health and maintaining responsibility in our daily lives. So we're actually feeling very positive about it. We think that we have the upper hand here. It comes down to local ordinances, local responsibility, as well as personal responsibility. So that's what we're watching. We're feeling good about it, and we're looking forward to everybody being able to get back to a different world, but safely.
Well, Dr. Sands, Dr. Jackson, thank you so much to you, and extend the thanks to your team. It's just been so, we feel so supported in getting back to the stage. So Jonathan, I'll toss it back to you.
Yeah, so let me reiterate, Dr. Sands, Dr. Jackson, thank you for your help on this project. This past year has been one emergency operation after another for HCA, whether it's tornadoes or flooding in Middle Tennessee or hurricanes in Texas or a global pandemic. I know these things have taken up so much of your time and attention, and to keep HCA's hospitals and clinics, to keep them safe, and for you to carve out some time for us means everything. So thank you.
Oh, absolutely. It's been a pleasure. Thank you for involving us.
Quite so. Our absolute pleasure, Jonathan.
All right. Thank you.